first item on our agenda is a COVID update from the town. Are you going to do that, Patrick, or is?
No, I think Jim's on.
I did see him on, and so
How you doing, Bill?
I'm good. You gonna update us here?
Good, yeah. We got some more cases today. I believe we're up to 130 today. I think Melissa will probably update you folks on that. And for the most part, Board of Health continues to do a great job with Melissa and Trish and Rika and Jen in there. So we're appreciative of everything. Do you guys need anything?
I mean, I think it's a sad commentary, but it is things like this that show exactly how folks can work together. I mean, there's a lot of commentary about how government can be dysfunctional and so forth, but clearly in this crisis, at least in the town of Walpole, folks are really pulling together. And
it continues to do it.
Between you and Patrick, and obviously the health department in the forefront of all this, couldn't be prouder of everyone's actions.
Great. Melissa, anything else?
I mean, obviously, last week we let you guys know about our emergency order for the Home for Little Wanderers. So just to give you a quick update on that, we did receive some documentation today. We're not 100% satisfied with it, so we are requesting additional information prior to moving forward. So as we get that information, I'll definitely make you all aware of that.
What's not satisfactory about the report, Melissa?
What was it, Mona?
What's not satisfactory about the report?
It's very non-specific, we feel. So there's a few items. Obviously, it's a multi-pronged approach. So it's the health department requesting information, the building department, as well as the police and fire. So kind of just making sure that all of our requests were heard and that all the documents were provided to answer any questions that we may have.
Okay. Melissa, I know obviously, due to HIPAA regulations and so forth, there's not a lot of information you can give us about the 130 cases that we've had, but are they mostly in the community?
So they are within the community. They range from, as young as 17 up until 100 years old, male, female. We have some household members, obviously. So some, it's a whole family that confirmed with the positive cases. Some, it's just one family member. So obviously it's huge, the trace contacting. Right now, again, I know Rika was talking about it when I got on the call. Trish is obviously overseeing the cases. We are lucky to have the free school nurses to help out. And then as of last week, we did consult with the state through Partners Health for the trace contacting. So that will help out. So any cases that become too much for us internally to take over, we can send them off to DPH. So that helps out. You've heard a lot probably on what the governor's address about this trace contacting. Mm-hmm. It allows us to hopefully really have a good handle on the investigation, and then to obviously find out who has been in contact with positive cases to stop the virus from spreading. So it's a huge resource, and we're really fortunate to have it. The gentleman that was kind of the forefront of it, we spoke with him last week. And he's a great resource. And again, we've kind of already started that process. So we will continue it as we see numbers to move forward.
Okay, so we're not seeing a high concentration in the two long-term care facilities in town then? I mean, obviously, I don't
think anything higher than you're seeing in other communities. Like I mentioned before, so DPH is overseeing those cases because they're considered clusters if there's, multiple cases in these facilities. That being said, Trish, I know, has done an amazing job having outreach with the nursing supervisors, and we'll continue to do that because it is obviously within our community, so we don't want to completely lose touch with the cases within Walpole.
Right. Okay.
So what cases are we referring to the DPH, the ones that we can't handle?
So we can really transfer any cases to this trace contracting program. Typically, if they're already, household members of cases that we're already overseeing, we wouldn't transfer them because it's already kind of under our field of vision. We're already seeing these cases. We've already reached out to most of their contacts. If it's a priority case, it will get bounced back to us. So there's really no rhyme or reason of who we're sending off. It might just mean that our load is too full, so we'll just push it off. And again, we still have access to the cases, so if we do push off a case, we can still access it at any time. It's just really making sure that investigation started in a timely manner, and that it's a thorough investigation, and that our staff, including Trish and the 3 nurses, aren't spread too thin, obviously.
So we have enough people, not that we're getting overwhelmed with the number of cases.
We do. I mean, Trish, you can speak upon it, but I think everyone has a pretty good handle on the cases that are coming in, thankfully.
Yeah, I feel like, being able to divvy them up between myself and Rachel and the 2 other school nurses, it's definitely manageable. It's a lot more manageable because everybody kind of can take up that caseload, and it's been working really well.
Okay. Well, if you guys need any extra help, just help. I can't help.
Thank you, Mona.
Thank you.
Thank you.
Mm.
So I think that's it for the COVID. So, I mean, we can continue the meeting as usual, but Patrick and Jim.
We were at what, 91 cases last week?
Correct.
And now we're at 130?
130, which they did anticipate a surge around this time frame, so.
But you said 79 already completed monitoring, right?
Correct. Out of the 130, 79 have completed. So it's nice to have a number higher for those completed than those that we're currently monitoring. So that's a change from last week, which is a positive.
And when you
And
say
Melissa, we got like 16 or 18 today, right?
Today we did. We got 16 in today, correct.
so when you say completed monitoring, that means you've gone through the 14-day period and they're fine? Or
Correct.
they're
So
cleared?
if it's a positive case, it's a 7-day minimum that they have to be quarantined with 72 hours, asymptomatic, no medications, and then a contact would need to complete a 14-day quarantine period.
Well, I mean, we're certainly, it would appear we're in better shape than a lot of places. And kudos to the town and to the health department and everyone that's working so very hard to make sure that we stay as safe as is humanly possible.
Thank you, Bill.
Anything, Jim or Patrick, from the town that we need to be aware of?
I can't think of anything. Pat, can you?
The only thing that comes to mind, obviously, is the governor's order today delaying school for the rest of the school year. So that was a big piece of news that we found out today. And I know the school department's working hard to make sure that the students are all prepared for remote learning. It's an important distinction to make that the school buildings are closed, that the school is still in session, and everybody at the school department's working hard to make sure that they continue to provide public education to the students in Walpole. So I think that's the only real major update since the meeting last week, and I think we're all looking for additional guidance from the state as far as the reopening of the economy, and additional guidance from DPH to the health department as far as summer camps and pools and stuff goes. So we'll just kind of wait and see what happens. I'm hoping something comes from DPH in the next week or so. But no, I think since last week the only real update has been the school department stuff. So
Any sense from anyone about whether or not the governor is going to extend or lift his stay-at-home orders?
I think
Still
it's going to
too
be
early.
extend. My guess would be extend.
Yeah, I mean, that's what I would put my money on, but nothing.
No, nothing firm. I reached out to our senators and the reps today. Got a couple of responses, but they don't know. They just found out a few hours before the school was closing. They reached out. So
Because the numbers keep going high. We haven't reached a flattened curve yet, have we?
No, not yet, and testing still lags behind, so it will be interesting.
Yeah.
All right.
yeah,
So nothing else from Jim or Patrick?
no, thank you. Thanks for your support and thanks for meeting every week.
Well, and thank you guys for all of your efforts, and we'll wrap up the rest of our meeting. Thanks for
All right.
joining.
Thank you.
Thanks, all.
Take care.
thanks, guys.
All right, I think the only other thing on our agenda was the approval of the minutes of the April 4th meeting, or April 7th, rather.
Correct.
Were there any changes, corrections, additions, or deletions. I went through them. I didn't see anything that jumped out at me.
And
I didn't see anything.
Carol didn't see anything, she said.
All right, then we'll entertain a motion on those minutes.
I'll make a motion in regards to,
That we accept the minutes from April 7th.
I'll second that.
And I want to give a shout out to Jen because this is our first set of minutes that she did. So awesome
okay.
job, Jen.
Way to go, Jen.
Thank you.
It won't always be this easy, but we'll give you the first one. All right, motion has been made and seconded. Is there any further discussion on the minutes? All in favor? Aye.
Aye.
Did I hear Richard Bringhurst in there as well?
Yes.
Oh, okay.
Yes.
Then
Aye.
we have 500 on the minutes. Is there anything else that we need to deal with tonight?
Anything else that anyone else has? Trish, Rika? No. I think that's it.
Okay, well,
Hold on. Sorry, I did think of something. Sorry to jump in, Melissa.
oh,
Oh, jump.
We had a request from a food establishment today about, and I already reached out to the state about this, just to get their feedback on it. But Texas Roadhouse wants to start potentially selling raw meat packaged, like steak, that customers can buy and take home to try and supplement their business. So the state has had similar requests come their way. Other establishments want to do this. They've spoken to their lawyers. They don't see why a food establishment couldn't do this as long as they reach out to the health department prior to changing what they're doing, adding any new type of business or process. So I've been in communication with them. We talked about proper labeling, make sure that if they choose to add this as a potential option, that they need to reach out to us to confirm that this is what they're doing and provide us with their standard operating procedures, just so that we're aware. We just wanted to bring it up to you to see if there were any concerns, if you had any comments, just because we have heard that this is happening in other communities as food establishments are trying to find ways to help supplement their business as they're kind of hurting.
isn't the name is escaping me at the moment, but the restaurant that's down in the center of town, Conrad's, don't they currently offer the ability to buy steak tips and turkey tips and take them home? Are they selling them already cooked, or are they selling them to be cooked at
I
home?
was under the impression they were selling them raw. That's the first I'm hearing of it.
No, they've actually been selling them raw for a long time.
yeah, it's been a while.
I mean, I know that they did it in Norwood for forever, and I shouldn't say I'm pretty sure. I know from being down there from time to time, it has a little sign where you can say, order steak tips or turkey tips and bring them home.
Okay.
I just wasn't sure if they were selling them just marinated, ready to cook, or not. It sounds like they're marinated and you just bring them home and grill them up. So that may already be happening in town, and I don't see necessarily a problem with.
And the food
Texas
code
Roadhouse
doesn't
doing it.
prohibit it. It's just a change to their procedures. So
Right.
obviously we like to be aware when they do
Sure.
add something new, do something different, and potentially packaging, depending on how they package it, can lead to
Sure.
more requirements.
Oh, absolutely.
But we just wanted to bring it to you.
Yeah, so we didn't feel that an additional permit would need to be issued because they already have obviously a food permit, which allows them to prepare and produce food. We just want to make sure that anyone is aware of that is going to be doing this, that they bring it to the Board of Health or the Health Department's attention. Like
Right.
Rika said, so we have a standard operating procedure and we know that they're doing things properly. We don't anticipate this being the only establishment looking to do this, especially when word gets out, because again, they are trying to supplement, they're not working at full capacity that they normally would be
Right.
given the circumstances.
Well, I mean, it's been going on in town whether we knew about it or not for some time down at Conrad. So as long as they're handling it properly and packaging it properly, and folks aren't just throwing a few steaks in the back of their car and letting them sit there for 3 hours before they get home. I suspect that it shouldn't be an issue.
That's not the restaurant's, fault. If you raw meat sit in your car, that's your responsibility, basically.
You would hope not, but in today's litigious society, who knows what people will claim. You didn't tell me I couldn't leave it in my car for 5 hours before I cooked it.
Oh, common sense, Bill. Common sense.
Sometimes that's very lacking.
I know businesses, they're getting very creative now.
Well, no, that's good. Because I've always enjoyed their steaks, so it might be nice to pick up a couple of nice aged steaks from them and grill them.
Absolutely.
I'll have to give them a call if we're gonna be doing that. All right. Anything else that the board needs to deal with tonight?
To reiterate, so the Household Hazardous Waste Day has officially been canceled.
Right.
You'll see news advertising in the Hometown Weekly, the Facebook page, as well as the town page. So we're not the only community. A lot of our neighboring communities have done the same, and no one's really setting a new date until further information is given to us. And all of our vendors have been very understanding with that. So
All right.
we'll hopefully have a date in the near future.
Okay.
Yeah.
All right. If there's nothing else, we'll have a motion to adjourn.
I'll second that.
Motion's made and seconded. All in favor? Aye. Aye. We're adjourned. We'll see you all next Tuesday on the 28th.
Correct.